And this morning we've been talking about vaccinations for care workers. But while things are returning to something close to normal in many parts of society, campaigners say that's not the case in care homes. This afternoon, the West End actress Ruthie Henschel will head to Downing Street with hundreds of members of Merseyside-based Rights for Residents campaign group to call for an end to limits on the access residents can have to their families. Among them will be Diane Mayhew, the co-founder of Merseyside-based Rights for Residents campaign. A very good morning to you, Diane.
Good morning, Paul. How are you?
I'm very, very well, thank you very much indeed, Diane. When restrictions were lifted in most other parts of society, how much did things change in care homes?
Not an awful lot, to be honest, unfortunately. And I think, the general public are probably under the impression that everything's back to normal because there are no restrictions whatsoever in society. But unfortunately, that is not the case in care homes. To be fair, the official care home guidance from the government does acknowledge that every resident can nominate an essential visitor who can visit in all circumstances, as well as unlimited named visitors from the rest of the family. And unfortunately, many care homes are just refusing to follow the guidance point blank. And instead, they're imposing really harsh visiting restrictions. I mean, we've heard from members, Paul, that, they're lucky if they can get 15 minutes every 3 weeks because they have to make an appointment and they're being told it's subject to availability. So when they ring up and it's fully booked, they have to wait until an appointment becomes available. And it's just unbelievable when everybody else is just going about their daily lives not wearing masks, going to festivals where there's 90,000 people, and these poor people who live in care can't even see the son, daughter, husband, wife. It is beyond belief. It's inhumane.
So at the moment, then, it's very much up to the individual care home as to what rules they impose rather than being a blanket rule across all care homes.
Exactly, because some care homes are following the guidance and are allowing an essential visitor and, named visitors. And that's our argument. If they can do it, why can't the others? Why are they treating care homes like prisons? It's disproportionate to what's going on everywhere else. And, it's discriminatory as well, not to mention abuse of people's human rights. And unless the government make this law, then they will continue to, they're a law unto themselves, aren't they? And families and residents feel powerless to do anything about that. It's ridiculous. I mean, the thing is, Paul, they've been fully vaccinated, relatives take tests. There are no other precautions now that any of us can take. So what's the alternative? Keep them locked away forever?
Yeah, I mean, we were just talking before about vaccinations for care home staff. Obviously, not all care home staff have been vaccinated. So is it right that there is some caution until, staff are properly protected as well as residents?
Well, I think unless everybody in the community is going to be, vaccinated, then really I don't understand that logic, to be honest, because you can still transmit the disease anyway. This is our point all along, Paul, that we're either having restrictions or we're not. But you can't just exclude a group in these people who live in care homes just because. Why should they pay the price for everybody else's freedom? Care workers can go to festivals, they can go to football, they can go to nightclubs, whether they've been vaccinated or not. And then they're going in and offering personal care, yet somebody who has got a vested interest in actually seeing the mother or son or daughter, or they're not allowed in. It's just crazy. It's absolutely crazy.
And obviously there's this petition today going to Downing Street, started by Ruthie Henschel. It's been signed by over 250,000 people, actually. It's called Gloria's Law, which is named after her mum, who sadly passed away. Tell us a bit more about the petition and what Gloria's Law is calling for then, Diane.
Well, to be honest, Paul, Gloria's Law is calling for what is already in the guidance to be made law. We want a legislation that gives every care home resident the legal right to ensure they have an essential visitor. because in the guidance it says that an essential visitor can go in under any circumstances unless they tested positive themselves, because the government have recognised that the mental health and well-being of these people who live in care has been impacted because of the loneliness and isolation. So we want that made law. We also want the care home visiting guidance brought in line with the rest of society, who are no longer subject to any restrictions. But more importantly, we want the guidance mandated and penalties introduced for care home providers who refuse to follow it, because otherwise we're just going to be back to square one. And as you said, 270,000 people agree with us.
Yeah, you referred earlier on, you said 15 minutes every 3 weeks for, some visits. Obviously, no one would think that is adequate enough. If, proper visits, proper time spent with a loved one, what difference does that make to someone who's in a care home?
It makes a huge difference, Paul, because, as you know, Jenny's mum, my mother-in-law, was in a care home. Sadly, she passed away on the 2nd of August. But we did get to be an essential visitor. And if we hadn't have been with her, throughout the time that she needed us the most, can you imagine the impact that would have had on our mental health as well as hers? When we used to go in, we used to sing to her, we'd play DVDs, I'd do her nails, we'd help the carers because we'd feed her, freeing them up to go and see other people and offer the personal care. An essential visitor isn't about providing personal care. It's someone who has a unique relationship with that person, who has a shared history. And when we used to go in, honestly, her face used to light up. And that's not to discredit the carers, to be fair, were amazing. In fact, they came to a funeral. That's how fantastic they were. But they never once assumed that they were a replacement for us who were closest to her. And it's unbelievable that this is still going on. We've heard of people that are still being subject to pods and screens, husbands and wives separated. In fact, there's some publicity coming up shortly where this poor guy, who's in his 80s himself, his wife won't go to this designated room that they're forcing her to go to, so he can't see her. The situation is getting sinister almost. There are people that are bedbound who have to be hoisted to get to these designated rooms. How can that be acceptable? I think the public have got no idea what's going on inside not all, some of them are doing a sterling job. But let's not forget, it's not just the elderly either, Paul. There's young people who are disabled, people with learning difficulties who've been kept away from the parents. There are children. This could happen to anyone at any time. And it terrifies me, the thought of going into a care home now, knowing that I'd have no human rights whatsoever. I'd have no say in who came into my home. And the irony is they're paying thousands of pounds for the privilege of being held prisoner almost. My mum lives in the community. I don't have to make an appointment to go and see her. And she can see all her family. Boris Johnson said we have got to learn to live with it. And when he lifted the restrictions on Freedom Day, he said, if not now, when? Well, right back at you, Boris. If not now, when? They're living on borrowed time as it is. And, many people, it's too late for them. And I just worry for the future of anybody who has to go into a care home. It's all very well Boris saying he wants to fix social care, but unless he fixes this visiting issue, then there is a growing reluctance for anybody to place a loved one in one.
Well, that's a very strong and passionate case you've put forward there, Diane, and I thank you for that, and I thank you for coming on as well today. Take care of yourself.
Thank you. You too. Bye.
Bye. That's Diane Mayhew.